زي ما حكينا راح نحكي عن ال drug prescription و how to write the proper prescription paper. ف brief outline راح يكون عندنا راح نحكي ال indications ال prescription example كيف نكتبها, ال common drugs اللي احنا بنكتبهم, وال drug precautions, وبالآخر راح نحكي من المحاضرة من عملة references. Sorry. Now, why would we write any drug? Why would we write a prescription? Either to kill pain as a painkiller, to reduce the pain, to for infections, either to prevent them or to treat them. We can either prevent infections or treat infections. Sometimes for diseases, to treat them, and sometimes as a palliative treatment. In patients who have unoperable CA, when we can use these medications or painkillers to reduce the pain in these patients. Now, prescription example. A proper prescription should have the patient's name, the age, the address. Sometimes they say it should be present in case you need to follow up the patient if he took a wrong medication or something like that, and today's date. Now, the patient's name and the age are important, so the patient, we know this patient took this medication, not another one can take it. The date, sometimes if we prescribe opioids, this is a very big problem for us, because if the patient gets addicted and this medication should last for like 10 days and that's it, nothing more. The patient, if we don't write the date, he can use the prescription again over and over and over again. And in some papers we can find that the patient can have refills like 1, 2, 3, 4, 5 or whatever. Now when we write it, there usually should be a word RX, which means treatment. Then we start with our medications. We write the medication. Let's say I'm going to prescribe amoxicillin alone. I will write the name. We can write the generic name or the trade name, but it's preferable always to use the generic name. We write amoxicillin, the dose 500 milligrams, frequency how many times per day. We can write 1/3/5, meaning that this patient needs to take this medication 1 pill 3 times daily for 5 days. And the route of an intake, which means how the patient should take it: oral, IV, IM, intramuscular, intravenous, subcutaneous, or whatever. Then in the end we write the signature, the name, and the stamp. So let's talk about a little bit of abbreviations that we might find difficult. RX, as we said, means treatment. PO, per oral, means this drug should be taken orally. PR, per rectum, which means this drug should be taken rectally. IV, intravenous. IM, intramuscular. So these are the usual routes, and we can have subcutaneous. Now, OD, once daily. BID, twice daily. TID, 3 times daily. QID, 4 times daily. Now, PRN, the abbreviation is Pro-Renata, which translates, let's say, into when needed. So when we say this drug like paracetamol, PRN means when needed. When there is pain, the patient should take it. What does it stand for? Okay. Pro-Renata means that we need to take this drug when needed. Q, when we say Q 6 hours, means every 6 hours. So Q means every. We can say Q8, every 8 hours, and so on. ABD at bedtime. This drug should be taken once the patient wants to go to sleep. EOD every other day. Okay? So, this is an example of prescription. We say the patient's name, the age, the date of the prescription. For example, here we wrote amoxicillin 500 milligrams per oral, 1 by 3 by 7, up to 7 days. 3 pills daily. Paracetamol 500 milligrams PO per oral, Q 4 hours. Every 4 hours the patient should take 500 milligrams. The maximum dose of paracetamol per day for a healthy patient is 4 grams. So he can take more, up to 3 grams, up to 4 grams, it doesn't matter. But less than 4 grams, that's the most important thing. Okay? Chlorhexidine, 0.2 mouthwash. We need to say that it's a mouthwash. So chlorhexidine should be specified. 0.2%, 1 by 2. Okay, 2 times daily. We close the remaining space, so we should not allow the patient to add another drug, and the name and the signature. Now, let's say an example. What does it mean if I wrote this? Amoxicillin 3 by 1. This means that the 3 pills together 1 time daily. So 3 by 1 means that we should take 3 pills 1 time only a day. 3 pills together. See, so that's why we need to be careful when we write the prescription. So to simplify it, the first number here says how many pills we're going to take per day, or per 1 time. Here, the 3, the frequency. So once, 1 time, 3 times, 4 times, depending. And 7, or the last number, is the duration. Okay? So the common classes of medications, we either prescribe analgesics for pain, antimicrobials, antihypertensives, antidiabetics, narcotics. These we will not prescribe them. The physician will prescribe those. So the most common one that we use is paracetamol or acetaminophen. The 2 generic names, Panadol, Panda, Adol, all these are trade names. It's an analgesic, so it's mild to moderate pain, we can use it. It's antipyretic, it reduces fever, and it has little to no anti-inflammatory action. So the dose 500 to 1 gram Q 4 hours. It selectively inhibits COX activities in the brain. It's the most common drug to be prescribed. Now, others, non-steroidal anti-inflammatory. They are antipyretic, anti-inflammatory, and analgesics. These are very good medications. Why? They give us 3 features. They reduce fever, they reduce the inflammation, and they reduce pain. Perfect. Including aspirin, ibuprofen, naproxen, diclofenac sodium, diclofenac potassium, and so on. Now, we have 2 mechanisms. We have the COX enzymes, COX-1 and COX-2, preventing the formation of prostaglandins and leukotrienes. The dose usually 400 to 600 milligrams depending on the medication, 4 to 6 hours per day. Q 4 to 6 hours, so around 4 times per day, which will be considerably safe. When can we not write non-steroidal anti-inflammatory? What are the precautions for the anti-inflammatory for the non-steroidal medications? Children less than 12 years old, this is associated with Reye's syndrome, encephalitis, and liver failure. And this is especially associated with aspirin. If the patient has a bleeding disorder or on any anticoagulants, we should be careful when we prescribe these medications because they will increase the bleeding. So, as we know, aspirin is an antiplatelet. That's an important thing that we should know. Peptic ulcers, they will increase the ulcers. They will have reduced prostaglandins. They will prevent the mucus secretion from being produced and protection of the linum of the stomach and increasing the acid secretions. In pregnancy, it can cause prolonged labor, bleeding, and early closure of ductus arteriosus. Renal or hepatic failures, asthmatics, lithium, all those, we should be careful when we prescribe these medications. In renal or hepatic failures, it's preferable to either reduce the dose as much as we can or not use them in general. Opioids, we don't prescribe them, so we don't need to know about them. Only that in the USA, in the UK, there is codeine, which is an antitussive medication to reduce the cough. It can be mixed with paracetamol as Revacot, 500 milligrams, 1 to 2 tablets by 3, and this is important. It's very good analgesic. And tramadol for severe pain, 50 to 100 milligrams, 1 by 3 PRN, means Prorinata, but up to 3 pills per day. Sometimes if a patient has a TMD problems, we can prescribe them Myogesic. This Myogesic can be prescribed either 1 by 3, 3 times per day, or 2 by 3, 2 pills 3 times daily, up to 6 pills. And we should say to the patient that this drug is kind of sleepy. It causes the patient to be sleepy, so he shouldn't use it and drive. Now, antimicrobials, we have antibiotics, antivirals, antiprotozoal, antifungals, a lot of them. Okay? Now, antibiotics like penicillin, the most common one need to be used is amoxicillin, 500 milligrams, 1 by 3 by 7. Now, its mechanism of action is by beta-lactam. But some bacteria, they have a beta-lactamase, which destroys the beta-lactam, which causes the amoxicillin to be non-functional. The patient will not get better at all. That's why they added something called clavulanic acid. This will work with the beta-lactamase, destroy the beta-lactamase, allowing the amoxicillin to work its usual function. And usually Augmentin or Curam or Amoclan, there are many names. Usually 625 milligrams 1 by 3 or 1 gram 1 by 2. Ampicillin can be prescribed as well, 250 to 500 milligrams, Q6 hours or Q8 hours. Flucloxacillin, 250 milligrams 1 by 4 for Staph aureus. The most important thing that we should know, penicillins, they have adverse effects. Hypersensitivity, causing anaphylactic shock, and sometimes they can cause diarrhea. Now, we have cephalosporins, which are cell wall inhibitors as well. We can have first generation, they work on gram positive. As we go to the fourth generation, the gram negative increases. So the first one works against gram positive, like cefalexin. The second generation has small effect on the gram negative, like cefuroxime. The third, a greater effect on the gram negative, like cefotaxime 1 gram IV or IM. The fourth generation, greatest against gram-negative bacteria like ceftriaxone, 1 gram IV or IM. Hypersensitivity: 10% of penicillin patients might have hypersensitivity to cephalosporins. And vancomycin, a cell wall inhibitor, we will not prescribe it as a dentist, you will not need to prescribe it. Metronidazole, flagyl, 250 to 500 milligrams, 1 by 3. Now, erythromycin, clindamycin, clarithromycin, or azithromycin. Now, clindamycin has been given to the name that it's good in cases of patients who have allergy to penicillin. It can be given 150 milligrams, 300 milligrams, 600 milligrams. The maximum dose is 600 milligrams. So 150 up to 4 times daily, 300 twice daily, 600 once daily. Antifungals can be prescribed as well. Nystatin for oral thrush, 400,000 to 600,000 units, 4 times daily. Miconazole, angular cheilitis or oral thrush, oral gel, 25 milligrams per milliliter, 2 to 5 milliliter, 1 by 4. Cream, 2%, 1 by 3. Fluconazole, it's 100 milligrams, dispense 15 tablets and 2 tablets on day 1 tablet a day, and the remainder for the 14 days treatment period. Antivirals can be prescribed, acyclovir, but usually it should be prescribed once the patient starts to feel that the symptoms are coming. So if the symptoms appear, it's not functional at all. Chlorhexidine mouthwash, 0.12 to 0.2% concentration, 1 by 2. The side effects: staining, so we should not use it for more than 14 days. We stop them and then we can go back after 1 or 2 weeks of not using them. Povidone iodine can be used also, but it's contraindicated in cases of thyroid diseases. Now, let's say I want to prescribe a medication for a young child. How can I do it? There are multiple rules, but we can have simple way of knowing it. Let's say Clark's rule is the most commonly used: weight in pounds over 150 multiplied with the adult dose. Now, Young's rule for children 2 years and above: age and years over the age plus 12 multiplied with the adult dose. Now, the weight is more accurate, but also every medication has the dose for the children. For example, flagyl or metronidazole, 50 milligrams per kg. So if the child is 10 kilograms, he can get 500 milligrams, the maximum dose a day. So then we can classify it depending on it. So we can give it like 2 times per day, 1 time per day, or whatever the route we want to use. So that's it. Hopefully it was a good thing. Any questions, of course, anytime you want. I'm always available, and thank you.